Hello, welcome everyone. Please give me 2 more minutes. We're just waiting. It's 2:01. We're just waiting for another 2-3 minutes to get a good number of people because we have 200 people who registered. So we are just waiting and we will start in the next 2 to 3 minutes. Thanks for your patience.
हाँ हाँ इसका आवाज है तो सुनाई। अच्छा अपना म्यूट ऑडियो यू आर म्यूट बाय होस्ट।
Let's begin. It's 2:05, 2:06. So, for all those who joined, welcome. Thank you very much for joining us today. I'm going to start. Let me quickly introduce myself. I'm Shelja Mehta from Dasra organization. We are part of the National Coalition on Risk Communication and Community Engagement. Uh, we're part of the group of development partners, and Dasra is a not-for-profit that works with a lot of stakeholders, including funders, philanthropists, foundations, NGOs, academicians. The idea was for us to bring together all of the different stakeholders, especially our civil society partners, and take forward the message with all the development partners and especially with the Ministry of Health and Family Welfare. हमारी ये सोच थी कि हम ये जो मैसेज है which is on prevention of stigma and discrimination वो amplify करें NGOs और civil society partners के साथ हम शेयर करें और ये जो आज का मुद्दा है आज का जो स्केड्यूल और एजेंडा है उसमें हम काफी स्टेक होल्डर्स से सुनेंगे there is UNICEF, WHO, we also have SEVA, we have a lot of the support of Ministry of Health and Family Welfare, as well as some of the other partners and supporters who have made ensured that we are able to make this webinar happen. So with that, let me say a very warm welcome to everybody. This webinar, ये जो एक webinar है, it's a part, the first part of a series. हम ये चाहते हैं कि ये जो dialogue है, the dialogue that is there, that we need to have with all of our civil society and other partners is to ensure that we continue this conversation. It is not a one-time conversation. There is a lot of best practices we can share. बहुत हम एक दूसरे से सीख सकते हैं, जान सकते हैं. It has been a pleasure to work with all the development partners as well as the ministry because काफी data collect हो रहा है और ये जो difficult time है उसमें it is very important and Dasra believes it's very important to come together collaboratively to support vulnerable populations. And I specifically represent the initiative called 10 to 19, Dasra Adolescence Collaborative, that works on the issue of vulnerable girls and youth in areas of education, employability, health, agency, as well as education. So having said that, I want to welcome again all of you, and I am going to look at having a few speakers. But before that, मैं आज का जो agenda है, I am just going to share with everybody, just for you to know. This webinar is going to go on till 3:30 p.m. So it's a slightly long webinar, but please stay with us and bear with us. Because this webinar is not just to talk about views and opinions, but we have a lot of partners who are going to share and train us on the messaging, the narratives, and all the efforts that each of us can individually as organizations take forward to prevent stigma and discrimination. So uske saath, let me start with the house rules. If I can just have Dasra please share the house rules. Yeah. So ये जो है हमारी webinar, like I said, 3:30 बजे तक चालू रहेगा. This is a positive and constructive space. So we please request everybody that do use the chat function to chat. There will be time for question answers. However, there is a lot of information that needs to be shared. काफी information है. So we will have to keep a very tight schedule और शायद आपके सभी questions answer ना हो या response ना मिले. So don't worry. Please email, as you can see, 10 to 19 community@dasra.org. Please email us in the chat box if you have questions. We will be collecting that and we're happy to do follow-up sessions, emails, calls to answer your questions with the right stakeholders and partners. So please ensure that all of the comments, all of the questions, the discussions are in a constructive space. That's one. Secondly, for everyone to know, This is a live broadcast. So not only are we live, broadcasting this on YouTube, but we are also recording this for purposes of dissemination. So just wanted to clarify that to everyone. Thirdly, please do respect all the speakers. There is a function of raising hands that you can use. And like I said in the chat box, questions, answers, and comments and opinions are very welcome as long as they are constructive. You can disagree, you can agree. Of course, you are free to voice what you would like to, but ensure that we do it with respect as well as constructive, outlook. We will keep all of the participants who are not speaking, their mics and their videos off, just to ensure that the speakers get uninterrupted time and the ability to present. If you cannot see slides or you are having problems, please do either email us or put it on the chat, and we will try and adjust the problem for you. But we are very aware. We have our team who's making sure technically we are fine. And lastly, we are going to be doing, we are going to try and do a multilingual, because we have people from all across India with different language preferences. Unfortunately, we will have to kind of do between Hindi and English. We will look at Hindi translation on the chat box as much as possible. But again, please bear with us. We can do any offline discussions if you want in the language of your preference. But unfortunately, there are certain limitations we also have. So there is going to be a large part in English and Hindi as much as possible. We have requested all speakers to try, and we've recommended if they can do it bilingually. And lastly, for any follow-ups, please email us. So with that, I'm going to pause here. And if we could just quickly shift to the agenda so that everybody can see the flow of the session. I'm not going to go through the details. There's going to be very quick welcome introductions that we are almost done. I am the facilitator for the day. Like I said, my name is Shelja, and I will be telling each speaker, when their time has come to speak. And there are strict timelines that we will be maintaining. So thank you everybody in advance. And मैं पहले से apology मांग रही हूँ in case मैं थोड़ी rude लग रही हूँ when I ask you to keep to time. We will be also having some poll questions, and the main part of this is when you look at the agenda, it's when Dr. Ritu Chauhan, Dr. Vivek, Rachna Sharma and Elnur from WHO, UNICEF are going to be speaking and training us. And we also will have Rehana Ben Riyawala from Seva, who's going to be speaking to us and sharing the experience, insights and learnings, as well as a few of her colleagues जो हमारे साथ testimony और anecdotal learnings भी बताएंगे. So with that, is Siddharth on? Is Siddharth from UNICEF on?
Yes.
Yeah, so if I could please request Siddharth Shrestha, Chief Communication for Development, UNICEF, to please give overarching, introductory notes, and then I will key up the.
Sure. Thanks, everybody. Great to have so many participants here. Special thanks to Mr. Rajinder Chowdhury, Chief Media for the Ministry of Health and Family Welfare, as well as Rehana Ben from one of our partners, Seva, in the fight against COVID, as well as routine immunization. I think Shailaja has already mentioned quite a bit about why we are organizing this webinar. I would like to go just on why are we doing, the whole thing is about stigma and discrimination. So why stigma and discrimination is important to know. As we see, the pandemic is triggering a lot of strong emotions and events. You've seen a lot of, you've heard of the news where, frontline workers are being stigmatized, the health frontline workers as well as patients. It's not only happening in India, but also around the world. And this has been seen since, beginning of March 2020. So what happens as a result of this? As a result, people are unsafe, the service providers are unsafe, and patients are also unsafe. That is why the Ministry of Health and Family Welfare decided to, do this campaign with the support of development partners, including DASRA, UNICEF. There's a whole bunch of partners now, 13 development partners who have agreed to support this very important issue. And it's not a 1 week, though we are calling it a campaign. Sorry, we are calling it a campaign, but it's more of a longer term intervention. In this campaign or intervention, we have three, like I said, there are three main target groups which we are trying to give the message for them, on behalf of them, which is the health frontline workers as well as the ancillary workers, also people who are in quarantine or those who have been quarantined, people with mild symptoms, as well as the ancillary staff. And now two more big big groups have come in, which you'll agree with me that they also need to be protected from stigma and discrimination, which is the migrant workers as well as the urban slums population. In this intervention or in this approach, though there is my colleagues will talk about the the rules and regulations which have also been changed for stigma and discrimination. It cannot be a punitive approach. That's why it's the whole campaign or intervention is based on a positive narrative around love, compassion, and solidarity. And there are four approaches to this strategy, and that's where I think, whether we talk about community engagement, whether we talk about advocacy, I think civil society organizations are at the heart of. Sorry, I'm just trying to do this.
You, Sid, if you could,
Yeah.
speak closer to the mic, and if there is, there's some disruption. So
Okay, I'm almost done. So, why are you all here today? Because we believe that civil society organizations are key to ensuring the success of this entire campaign, particularly on issues. We know that you do have a very commendable presence in the communities, and this is absolutely important because of the fact that what we have been doing so far, particularly for risk communication, is mostly limited to digital engagement and not the real community engagement. And that's why I think it's absolutely important to have that one-to-one approach also, since you have the footprint in the communities. When we talk about stigma and discrimination issues, you cannot just have a WhatsApp message and expect to change behavior of the population. There needs to be this real-time engagement. And that is why I think you are critical in supporting this process. So thanks to Dasra also for bringing all of these, all of you together. And we would definitely request your undivided attention to all the sessions which Salaja has already mentioned. So all the best for a productive learning. Stay safe and well. Over to you.
thank you. Thank you very much, Siddharth. I also wanted to thank all of the colleagues of UNICEF and WHO who have helped us. I also want to mention USAID, who is our key partner for this. So thank you, USAID, as well. Moving on, I wanted to invite, and thank you so much, Mr. Rajinder Chaudhary, Chief Media Officer, Ministry of Health and Family Welfare. Thank you very much for agreeing to speak to us. It's very important for us to continually have government participation as well as engagement, and we look forward to your address. For the rest of the participants, we will continue being the channel to continue to amplify and share with civil society organizations all the information, directives, and trainings that we get from the ministry. Over to you, Mr. Chaudhary.
Good afternoon. Thank you, Shelja. Thank you, Siddharth. I think you have very clearly brought out the focus of today's webinar, and we have made the right kind of beginning by understanding what exactly we are going to discuss in the next 1 hour. From the ministry point of view, I would say that as we are all facing this COVID-19 pandemic, the real challenge, which so far does not seem to have been discussed in that great detail, has been the stigma. the fact that there has been discrimination against people, not only against the patients, but against healthcare workers and other people associated with the healthcare community. And this is something that really needs, I would say, last mile connectivity from point of view of our NGOs, our civil service organizations. We have been doing our part in the sense we have been having a lot of awareness campaigns. Every day you see our social media campaign is primarily now focusing on stigma, not primarily, but it has been one of the most important factors for us also. And here what we feel is that role of CSOs become extremely important. We have had personal experiences. We have people talking to us and telling us that somebody in a society, housing society, gets infected. And there are people within that society who start calling the police that this person should be removed. That is the kind of stigma that we have seen in some places, not everywhere. There have been cases where people have been very supportive. People have welcomed, not welcomed, but in a sense supported people who have been diagnosed with COVID and have given them all possible support. But there are a lot of gray areas. And what I could also make out from our experience so far has been that not very many people are really aware about the disease itself. Means there is so much of changing perception about the disease that people become afraid. Sometimes they are extremely terrified. Sometimes they are saying, no, nothing is going to happen. So there are very wide spectrum of opinion about the problem itself. And that's why I would say CSO and our NGOs become extremely important. They have the last mile connectivity and they can actually also diagnose the fact, or they can actually find out what a particular society is thinking, because the response of the societies itself has been very, very different. As I said, in one case, if a patient is diagnosed, the other society members living in the same housing society could be giving them full support. There could be another housing society in which if a person is diagnosed, somebody within that society is actually calling the police and asking them to be taken away. So that's why, even though we may have a lot of multimedia campaigns, mass awareness campaigns, social media campaigns, but how to make sure that it is localized, how to make sure that it addresses the particular concerns in that particular society, how do we make sure that it takes care of the kind of, I would say, literacy disparities that may be there. There could be a society in a village where we have found people to be stopping people from one particular community to even enter the village, just a mass stoppage. So that is something that I think our CSOs will really do well to help us out. One more thing that we look forward from this webinar and the continuity thereafter is that we have to build on the bank of messages. We are already doing a lot of things. We have created punchlines. We have used celebrities to create messages spread across the world. But as I said, with a country with as much of diversity as India, every possible medium is required to reach out to the last mile. We could be having good efforts from our celebrities like Akshay Kumar and Amitabh Bachchan. They would help us reach out to a big segment of population. But still, if an NGO goes to a village, they create some kind of an activity there, they spread a message in a particular way, they use the Anganwadi workers, they send bulk SMSs. There's so many ways by which we can address it. So we in the ministry really are thankful to all of you for being present here and giving us this kind of an insight, and we look forward to more continuous interaction with all of you. For me, from ministry's point of view, we would certainly be listening to the entire conversation, taking out the main takeaways, and then looking forward to what all we can all do in future to make sure that the stigma associated with this particular disease and with all the persons associated with it can be really taken away. There could be a number of interesting ways by which we can do it, and I look forward to this webinar to find out what all these measures can be applied in a local way so that the message gets spread across in the language of the people as per the circumstances surrounding that particular area. This, I think, is extremely important. We cannot have a generic message at the central level going across to the entire country. There have to be area-specific interventions, and that is exactly where our NGOs and our CSOs are going to help us. Once again, welcome to all of you. Thanks all of you for giving your valuable time for such an important thing that is affecting all of us in such a big way. And we look forward to very, very constructive discussion and some very good takeaways, which we will then take forward for our future media interventions. Thanks.
Thank you. Thank you so much, Mr. Chaudhary. And yes, I echo the thank you to all the participants also. This is a great collective and collaborative effort for all of us, each and every one of us, to do our bit to support in COVID relief. As the next step, I wanted to request cooperation from all of the participants currently on. We're going to do a very quick live poll. So what will come up is on the screen, there will be a few questions, a very quick, multi-selection, multi-option. You have to just select a few options. So if I could request the Dasra team to please share the poll right now on the screen. If the participants could just wait for a minute. There we go. So if you can just see, and you have to go, please choose your options. I'll just wait for 2 more minutes. We have another 20-30 people left to participate in the poll. So I please urge all of you to just click on the options. We are at a 72% participation, just a little more. Okay, great. Yeah. Thank you. I'm going to share the results now. Yes. So on this group, we have about 12% of INGOs, 76% NGOs, 6% of funding organizations, and 5% of government participation. So you can see it's a multi-stakeholder group, and it's great to have our colleagues and peers from the civil society as a large part of the participants. So thank you very much, and we can stop sharing now. Yeah, is there another poll that we have to share right now? Another set of questions are there? Yeah, and don't worry, these poll questions are just for us to get to know what the group is like. And it doesn't matter if you are currently or not currently carrying out any initiatives. It's just good for us to know what's happening on the field in the communities. Okay. Okay, let's share back. Yeah. So as we can see, a large part of the civil society members and all the stakeholders in this webinar are in fact 74%, almost 75%, 3/4 are carrying out some kind of initiatives to combat stigma and discrimination. And so that's very encouraging for us to know and see, and therefore all the more valuable for each of you to be part of this webinar and take forward some of the work that we're going to hear about and learn today. And if I can just now, there's one last question. So if I could please ask one more question to be polled. Yes. This is a multiple choice question. Oh, sorry. Yes, sorry. It isn't multiple choice. I'm so sorry. But just choose the one that you all feel is the most and we'll collate it. Yeah. Sorry. Just choose one. The one, maybe the most critical one that you are working with. Okay. Let's share back. Yeah, so as we can see, not only the patients, migrant workers, health workers, frankly, this was not a multi-choice, but if I would have given everyone a choice, really, a lot of them would be, more than maybe 30 to 40% selected. So I'm aware of that. And thank you so much to everybody for, filling in this. It just gives everyone here, especially the speakers, and for us to take it back, the questions and the answers and response we got, for us to understand how how we are going to be able to ensure that the communication also we give is across some of these target audiences. Okay, so if I can now move forward, and I know we have a lot to go forward with, we are now coming to the main part of the session. So this is going to be Dr. Ritu Chauhan, National Professional Officer, IHR, Health Security and Emergencies Team, WHO India, as well as Dr. Vivek Singh, Health Specialist, UNICEF. They are going to be speaking to us and giving us a lot of learning, information, and training on some of the messaging of prevention of stigmatization and stigma and discrimination. So I hand over, if we could just move on, and if I hand over, please share the PPT, and over to you, Dr. Ritu and Dr. Vivek.
Good afternoon, everyone. Am I audible?
Yes.
Okay, thank you so much, Shelja, and wonderful to see so many civil society partners connected today. Greetings from the World Health Organization, and also that the very fact that how Ministry of Health has acknowledged that stigma and discrimination aspects related to COVID-19 is becoming a very important factor in our collective fight against COVID-19 in India, and how we as a collective group can help to address some of these emerging concerns would be very important. So we are here with a technical presentation to help you understand how as civil society we can how we can help recognize that this is a problem. And it is also nice to hear from the poll results that many of you are already contributing to this particular response. And today, after today's session, we hope that you will be able to have a much greater understanding, not only of the dimensions related to stigma, but also how you can actively contribute in the areas of work that you're already supporting, and the local administration who very much would look forward to this kind of a contribution from the civil society partners. So if we can start with the first slide, which talks about the outline of the presentation. Yes, so you can click all the parts of this particular slide. Yes, so in this presentation, friends, what we are going to learn is what is stigma and what is the genesis and source of stigma, why we are seeing so much of stigmatizing behavior against several groups of people, what does stigma do, and what civil society can do. तो आज हम इस presentation के माध्यम से ये 4 चीजें सीखेंगे कि stigma related behaviors कैसे हम identify कर सकते हैं, क्यों होता है stigma, और स्टिग्मा की क्या मैनिफेस्टेशंस हैं इस तरह के पक्षपात, इस तरह के डिस्क्रिमिनेटरी बिहेवियर से क्या क्या डायमेंशंस हमें देखने को मिल रही हैं कोविड-19 के अगेंस्ट, और सिविल सोसाइटी इसमें क्या योगदान दे सकती है, हम कलेक्टिवली हम क्या केयर एंड सपोर्ट प्रोवाइड कर सकते हैं So I will now invite Dr. Vivek Singh, health specialist from UNICEF, who will walk you through some of the initial slides of the presentation and explain what is stigma and why we are seeing so much of stigma in the context of COVID-19. So over to you, Vivek, for the initial few slides and explaining the genesis of stigma itself, but also helping our civil society partners understand why we are seeing this kind of behavior, and also to understand that this is not exclusive to India. We are seeing stigmatizing behavior in many other multi-country settings, and I think it's very important for us as a global community to understand why and the what of stigma in itself. So over to you, Dr. Vivek.
Thank you, Ritu. And for some reason, I'm not sure. Am I audible? It says you're not allowed to. Okay, so the video is stopped by the host. No problem. Am I audible?
I can hear you.
Shailja,
Fair enough.
Yeah, I'll enable the video. We can hear
Yes.
you, Vivek. Go on,
Yes.
I'll enable the video.
Thank you. So good afternoon, colleagues, and thanks, Ritu, for setting the context. And colleague, whosoever is helping with the slide, you can do all the animations because we'll only be using these as pointers. So you can complete all the animations on all the slides, please. So I think हमारे civil society partners को सबसे important बात जो समझने की है, when we talk of medicine, whenever there is an individual medical issue, then we only think of the medical response. जब हमारी routine diseases की आप बात करिए, but in any epidemic context, और especially जब वो epidemic global हो, pandemic हो जाए, so where society gets involved, so then more than the medical side of things, it's the societal side of things which become important in the response. And this is a classic public health situation. Any pandemic is a classic public health situation, जहां आपको न सिर्फ medical system कैसा है किसी country में, that will determine how effective the response will be. वहां पे ये भी जरूरी हो जाता है कि how are we tackling the societal side of the response, and it is in this societal side of the response that stigma has its origin. एक चीज हमें समझनी पड़ेगी कि globally, and somebody said it's a global phenomena, but if you look through different societies, I think the amount of stigma is directly proportional to the underlying values in a society. And let's not be ashamed in accepting that stigmatization is only going to surface the inequities a society already has. भेदभाव किसी भी सोसाइटी में कितना है, ये उस सोसाइटी की वैल्यूज को दर्शाता है, और हमको इसको एक्सेप्ट करना पड़ेगा, तभी हम इस पे रिस्पॉन्ड कर पाएंगे. Now coming to what stigma is and how it happens. So globally, if you think of pandemics, अगर आप plague history पढ़िए, plague या बड़े pandemics जब होते थे, cholera and all, or such an pandemic for influenza which was about 100 years ago. So what happens is, whenever these pandemics, diseases arise from another country, or imagine kariye, immediately there is a travel ban, and this is coming since ages. Even the word quarantine is from Italy. 40 days plague ke ships aate the. So the foreignness attached to any disease, कि ये disease बाहर से आई है, किसी और ने दी है, भगवान का wrath है, ऊपर वाले का wrath है, somebody has inflicted it on us. And what happens when we have all these travel bans, quarantines, people being forced into quarantines for medical reasons, or strictly enforced, police force aa jata hai because it cannot be managed easily only by medical. So then psychologically also, this foreignness of the disease ki kisi aur ki wajah se ho rahi hai, और कोई इसको cause कर रहा है, and somebody can spread that disease to us who are otherwise supposed to be healthy and normal. इस व्यक्ति की वजह से हो गया जिसने ये disease मेरे तक लाई. So this feeling is very historic and old. ki foreignness for any disease which is specially pandemic. Now, what is the origin of this stigma? The origin is this fear. And why is there fear? Because there is unknown. So imagine COVID-19 till today, we are learning new science. रोज हमें नई बातें पता चल रही हैं. And this is very typical in any new disease. So we know that this virus had jumped species, which means one animal species to another. We are still looking for cues. Most probably hypothesis is bats, but we still don't know. So we are trying to understand एक species से ये disease humans में आई, and we are still as humans, medical fraternity is trying to decipher a lot of things. And that is why this fear of unknown is leading to stigma, because there are a lot of unknowns, and when there are unknowns, there is misinformation and there is lack of information. So this leads to the stigma. Stigma ki ye disease hum tak koi la sakta hai. Now, who are the people being stigmatized? There are three groups of people who are primarily being stigmatized. Ones who are unfortunately affected themselves, infected by the virus. The others who are caring for them, and that is why perceived to be at high risk of transmitting that disease from those who are infected to others. जैसे हमने देखा डॉक्टर्स बाकी फ्रंटलाइन वर्कर्स के साथ डिस्क्रिमिनेशन हो रहा था कि सोसाइटीज में मत रहिए. एंड तीसरा वर्चुअली एनीबडी. सो आप बोल दीजिए कि एक जमात हुई या एक बड़ा कांग्रीगेशन हुआ, लोग एक शादी में इकट्ठा हुए एंड वहां से वो दे वेंट टू डिफरेंट प्लेसेस, एंड देन यू स्टिग्मेटाइज अ होल सोसाइटी, एंड देन व्हाट हैपेंस? Because you stigmatize a whole group of people, then people will start discriminating. Suppose एक किसी घर के सामने दो सब्जी वाले वेंडर्स आते हैं, and if that person is ill informed, not fully informed, and has a perception कि इस community के लोगों ने तो ये disease को फैलाया है, so that person might then discriminate and choose the vegetable vendor who's not from that community. So virtually anybody can get affected. Those who are infected by the disease, those who are caring for them, and those who are perceived to be the foreigners and the enemy. So हमको ये realize करना है that everybody can get affected, and that is where civil society has a role to play. So in any epidemic, it is common for individuals to feel stressed and worried, and because they fear, and because of the anxiety, this fear gets accentuated and we feel the stigma. And you can read through all this कि stigma कैसे exacerbate होता है, किन लोगों में होता है. The same thing which I said is repeated here. Next, please. You can just do away with all the animations. So as I said, this is just repeating it, that why there is stigma, because COVID is a new disease. There are a lot of unknowns, and rumors or fake news, when there are unknowns, misinformation फैलाने वालों को fodder मिल जाता है, and people can use this opportunity, some intentionally and some unintentionally, to propagate misinformation, and that is why it can accentuate stigma, और ये stigma और discrimination को बढ़ा सकता है. Next, please. Okay, so see, this is these are different scenarios, and by now we all must be aware, like what are the different scenarios to recognize when there is stigma. So for example, let's just look at only one of the examples. Pehla example on the left, you are in the grocery shop, there are several people who are wearing masks. You see Bulbul, the store owner, going red in his face, and he tries to suppress a cough. So Bulbul has simple cough if you look at the right side. But he is too scared that if he coughs, people might think isko COVID hai and iske yahan shop mein log aane kam ho jayenge. So it is this fear that people might stigmatize against me if they feel that my cough could be due to COVID. So this is the fear of the stigma which is leading to this behavior. And similarly, there are other examples given on how you can recognize ki stigma ho raha hai and फिर आप उसको कैसे address कर सकते हैं. Next, please. Now, this is a very important slide for us to focus on what can stigma do. And this is the reason that we are having these sessions and the role that civil society can play. So stigma can lead to people hiding their problems. And this is where the epidemic response is getting hampered. Hiding the problems mean it will take time for that person to come forward, which means more time for that person to spread the disease, more time for that person to jeopardize government's containment measures. Then keeping people away from accessing health services and seeking help. अगर stigma की वजह से वो देर से सामने आएंगे, like it was happening in Mumbai, in many parts of the densely populated slums, so then you would see high mortality, which is now decreasing luckily. So what happens is when you come forward late, the outcome is likely to be more negative. And that is why we were seeing people coming late to the health services, leading to adverse outcomes and more mortality. So उनका timely आना individual की health के लिए भी जरूरी है और वो disease को spread ना करने के लिए भी जरूरी है. Last thing, it can ostracize the health workers, demoralize not just the health workers, but others who are on the front line. So these are the three main issues that stigma can do to jeopardize the medical response, the epidemic response. Next, please. So I will request Ritu to take forward from here, but I want to close with one very important message. See, you would have realized that when we started the disease control, even those who were asymptomatic were being put in hospitals. So think from a societal perspective, क्या होता है जब आप disease को कहीं contain कर दो, so then this fear कि this person is spreading the disease was very high. So stigma and discrimination is accentuated. But what happens is, आज की डेट में the guidelines have changed in many states where mild cases, asymptomatic cases are now going to be managed in homes. So what will happen when people will start seeing people affected by COVID in their families, in their house, in their neighborhood, all around them, living with them, staying with them, then the stigma naturally as a societal phenomena will come down. It does come down. But what will not come down is the value part of thing which I said. For example, I just for professional and personal reasons, I had to take 3 flights last week and I traveled outside my home. I have self-quarantined myself this week. But मेरी home help जो मेरे घर में आती है, she does not have the courage to ask me, Vivek Singh, why were you out of your house? You can put me at risk. Because societally, she does not have that right. But I can ask her, you are a labor, you are a migrant, you are putting me at risk. So ये जो societal values की वजह से stigma है, that will take time to go, and that is where the civil societies will have to play a role. But Ritu will talk about that now more and more cases will be managed in home, and this is quite natural when you will see people affected by the disease in your homes, in your neighborhood. So some sort of stigma will also have to come down naturally. Over to you, Ritu, please.
Thank you, Dr. Vivek, for setting the tone and making people understand the genesis and the root cause of stigma that we are seeing. So, अब हम ये बात करेंगे कि सिविल सोसाइटी क्या रोल प्ले कर सकती है और क्या हम collectively कर सकते हैं. So, most importantly, what we see is that you are the voices of change in the communities where you work, and therefore we would like you to be the role models and explain to people wherever you are working in the communities with the local administration, the use of positive vocabulary. तो पहला मैसेज जो हमारे लिए है कि हम COVID-19 cases या victims ना कहकर हम बोले कि those who are affected with COVID, or even those who are under the suspect case definition, instead of saying suspect case है, हम क्या बोले? People who may have COVID-19. तो जब हम इस तरह की पॉजिटिव वोकैबुलरी यूज करते हैं तो स्टिग्मा कम होने में ये कारगर होता है. सेकेंड इज टू मेक स्पेशल एफर्ट्स टू रीच आउट टू हाई रिस्क ग्रुप्स. और हम क्या देख रहे हैं कि जो कोविड-19 से जो लोग अफेक्ट हो रहे हैं उसमें ज्यादा सीरियस आउटकम्स उन लोगों के हैं जो हाई रिस्क ग्रुप्स हैं, जैसे कि सीनियर सिटीजन्स हैं या फिर जिन्हें अंडरलाइन क्रॉनिक डिजीजेस हैं, डायबिटीज, हाइपरटेंशन, एस्थमा, क्रॉनिक किडनी डिजीजेस, क्रॉनिक लंग डिजीजेस. तो इस तरह की जो पुरानी बीमारियां हैं जिनसे कि लोग ग्रसित हैं और उसके संदर्भ में फिर उन्हें कोविड हो रहा है, तो दोज आर द पीपल हु आर एट रिस्क ऑफ सीरियस आउटकम्स. तो हम ज्यादा कोशिश करें कि हम इन वनरेबल ग्रुप्स को प्रोटेक्टेड रख सकें. और सभी का बिहेवियर, जो घर में यंगस्टर्स हैं उनका बिहेवियर भी इस चीज को इम्पैक्ट करता है. Those are the kind of messages we need to give, and let's all be role models here. So the second message that we have for you and where you can play a wonderful role is to amplify positive messages around COVID-19. देखिए friends, हालांकि ये एक नई बीमारी है और सारी कंट्रीज इसको जूझ रही हैं इस पैंडेमिक को, लेकिन फिर भी हमें लगातार लोगों को ये बताने की जरूरत है कि ऐसा नहीं कि अगर आपको कोविड-19 हो गया तो आपको सीरियस इन्फेक्शन होगा, नहीं। हम देख रहे हैं ज्यादातर केसेस में 80% केसेस जो हैं उन्हें माइल्ड सिम्टम्स होते हैं और वो रिकवर हो रहे हैं कोविड से। सो लेट अस do everything possible to share positive stories और हम इस तरह की positive messaging को share करें। In fact, 193-year-old is Indian has recovered from COVID-19. तो अगर इस तरह की भी हम stories share करते हैं कि जो लोग इसमें अच्छा योगदान दे रहे हैं, हमारे essential providers हैं, जो लोग affect हुए लेकिन ठीक होके अपने घर वापस आ रहे हैं, stories of recovery को जरूर share करें। और दूसरी चीज ये है कि हम जो है कैसे एज कम्युनिटी इन्फ्लुएंसर्स हम काम कर सकते हैं, हम इंफॉर्मेशन कैसे शेयर कर सकते हैं, हम फैक्ट्स शेयर करें कोविड-19 के लिए, तो उससे मिस इन्फॉर्मेशन, मिथ्स, ये सब कम होने में हेल्प होती है। और हम एक दूसरे को सपोर्ट करें कि स्ट्रेस को बेटर हैंडल, बेटर सपोर्ट कैसे किया जा सकता है, और इसके बारे में हम आगे भी बात करेंगे। नेक्स्ट स्लाइड प्लीज। Just keep clicking all the pieces. Yes. No, just go back to that. Yes. So this is a very important piece of information that we want to share with you, friends. And this is about where to seek help. तो देखिए, सभी को पता है कि 1075 की जो हेल्पलाइंस हैं मिनिस्ट्री ऑफ हेल्थ की, हम किस तरह से लोगों को गाइड कर सकते हैं कि अगर उन्हें कोई सपोर्ट की जरूरत है तो वो 1075 को कांटेक्ट करें। उसके अलावा हम सपोर्टिव इंटरवेंशंस की बात कर रहे हैं, जो लोग जो ज्यादा जिन्हें साइको सोशल सपोर्ट की जरूरत है, इमोशनल हेल्प की जरूरत है, हम उन्हें मिनिस्ट्री ऑफ हेल्थ की मेंटल हेल्थ और साइको सोशल सपोर्ट हेल्पलाइन से लिंक करें। और ये निम्हांस बैंगलोर की संस्था है और आप ये नंबर्स नोट कर सकते हैं। आई होप दसरा टीम विल मेक दीज स्लाइड्स अवेलेबल फॉर एवरीवन हु हैज लॉग्ड इन। चाइल्ड सपोर्ट की भी कुछ इंस्टेंसेस सामने आ रहे हैं, क्योंकि लॉकडाउन्स का टाइम है। हम ये देख रहे हैं कि कुछ लोगों को, बच्चों को, खासकर विमेन को जो इन डिस्ट्रेस हैं, हम कैसे गाइड और सपोर्ट कर सकते हैं। तो ये एज सिविल सोसाइटी हमारा रोल रहना चाहिए कि किस तरह से हम लोगों को, ज्यादा से ज्यादा लोगों को लिंक अप करें, ताकि ये जो भारत सरकार की सपोर्टिव इंटरवेंशंस अवेलेबल हैं, इसको हम कैसे यूज कर सकते हैं। नेक्स्ट। When we talk about coping with stress and psychosocial care and support, let us try to understand who needs it, how we can help people, how we can help identify those who may be in need for these kind of additional interventions, and how we can provide that particular support. Next slide, please. So, अगर हम देखते हैं कि कुछ हम अगर अंडरस्टैंड करने की कोशिश करें कि कुछ लोग हैं जिन्हें इस वक्त में लॉकडाउन का टाइम चल रहा है और एक बहुत चैलेंजिंग टाइम है, पर्टिकुलरली हेल्थ केयर वर्कर्स के लिए, जिन्हें की बहुत डिफिकल्ट सिचुएशंस को हैंडल करना पड़ रहा है। किस तरह से उनका वर्क प्रेशर तो है ही, बट wearing PPE in this very hot weather and putting one's own health at risk, और फिर इस तरह की जब स्टिग्मेटाइजिंग बिहेवियर हेल्थ केयर वर्कर्स के अगेंस्ट, डॉक्टर्स, नर्सेज, एम्बुलेंस ड्राइवर्स, इन सब के अगेंस्ट हम देखते हैं, तो उनका मोरल बहुत लो हो जाता है। एंड दीज आर सम ऑफ द इंस्टेंसेस वी आर सीइंग। सो किस तरह से इन लोगों को बहुत सपोर्ट प्रोवाइड करने की जरूरत है। इन जनरल हम देख रहे हैं कि पब्लिक बिकॉज ऑफ बीइंग फीलिंग हेल्पलेसनेस है, एक घरों के अंदर बैठना पड़ रहा है, जबरदस्ती वाली फीलिंग लोगों को लग रही है कि नहीं, कहीं आ जा नहीं सकते हैं, और गवर्नमेंट की गाइडलाइन है कि नहीं, आप बाहर ना जाएं और बहुत लिमिट करें, सोशल डिस्टेंसिंग मेंटेन करें। तो इससे जो है एंजाइटी और फियर की जो फीलिंग्स सामने आ रही हैं, वो सब रीजंस हैं जिनसे कि स्टिग्मा बढ़ता है। तो किस तरह से हम इन लोगों को एडिशनल सपोर्ट प्रोवाइड कर सकते हैं। बच्चों को जिनका की रूटीन बिल्कुल ही चेंज हो गया है, जो स्कूल नहीं जा पा रहे हैं, उनका कोई फिजिकल कांटेक्ट नहीं है अपने फ्रेंड्स के साथ, स्कूल्स बंद हो गए हैं, उनकी बहुत लिमिटेड एक्टिविटीज हो गई हैं, बोर्डम है। और किस तरह से पेरेंट्स और केयर गिवर्स भी बच्चों को इस टाइम पे स्ट्रेस कम करने में सहायक हो सकते हैं। इन सभी मुद्दों पे हमें सोचने की जरूरत है। एंड एज सिविल सोसाइटी वी हैव एन एक्टिव रोल टू प्ले in this particular regard. Next. So, किस तरह के symptoms हम देख रहे हैं? Excessive worrying, sweating, lightheadedness, arguments with colleagues, family, poor concentration, fatigue, sleeplessness, बहुत सारा anxiety जो हम देख रहे हैं. लोग जो है they are also consuming intoxicants, smoking, alcohol वगैरह का consumption भी हो रहा है. तो इस तरह से जब हम ये symptoms देखते हैं तो हमें इन लोगों को guide करने की जरूरत है कि कहाँ पे वो additional supportive care, supportive interventions ले सकते हैं. Next. Next. So as I said, please tell people about the help which is available from Ministry of Health website, helplines, help support families, children, call on the right numbers, share facts. जितना हम ज़्यादा से ज़्यादा COVID-19 के facts share करेंगे, facts about recovery, and asking people to be active while they are indoors, engage in bonding activities within families, being digitally connected, staying away from negative news, which 24/7 journalism sometimes tends to focus really a lot on, and also stay away from fake news. तो ऐसा नहीं है कि जो भी हमें WhatsApp groups पे आता है सभी कुछ correct है. Let us all think as society what we need to forward in our groups. Let us examine the facts as there are. Next slide, please. So we are also asking the parents to, be able to provide that kind of role, spend time, have family time, have meals together, help children develop certain routines, reduce their screen time, so that all these activities they can do and help, allay the anxieties which children are having at this point. Next slide, please. So a lot of coping with stress is needed at this particular time, not only for those who you are trying to help, but also those who are actively supporting COVID-19 response. Sabhi ke liye hamara kya message hai? Sufficient rest le, meditate kare, have healthy food, engage in physical activity, talk to your family, friends. If need be, reach out to counselors, and there's a lot of psychosocial help which is available from the ministry. Helpline numbers that you can guide people towards. Next slide, please. तो अब हम कुछ इस तरह के can we now move to the poll questions? Dasra team, do we have the poll questions as
we
that?
don't have the live poll, Dr.
Okay.
Chauhan. We can just share the slides and you can
Okay.
ask the group. Oh, we have.
Somebody wrote to me that there are.
Okay, sorry. Yes, it's here. It's on.
Yes. So can you look at these questions, and then we would like to have a poll based on your understanding. So can we show all the questions one by one? Team Dasra? So here we can see he's a vendor of vegetables, and he was wearing a face cover like other vendors. And he has even marked circles 2 meters apart in front of his cart, and a man has come and asked him to show his ID or Aadhaar card. So can this be a case of stigma? So we are also seeing that a lot of people are resorting to stress coping strategies, and some of them are positive and some of them are negative, and we need to understand what are the negative coping strategies as well. So please answer this question. And it is also important for us to understand what are some of the strategies which are more positive, and how as civil society, we can guide people towards stress coping strategies which are more positive in their approach. So this is a person who is otherwise quite affectionate and lovable, but lately there is change in his behavior and he keeps talking very loudly. And he's watching the news all the time and most of the news is negative. So can this be a cause of stress by watching negative news? So we are also seeing that certain behaviors are being exhibited by those who are on the front line and those who are responding to COVID-19. Yes, so see how stress is being manifested even in amongst those who are responding to the outbreak, and they feel they are so responsible and they are even cutting down on their own personal time, and they are not even resorting to coping with the stress in a positive manner. See, if you are yourself stressed, then it becomes difficult to support the response positively where all your energies may be needed. So this is a person whose supervisor has asked them to contact the Ministry of Health Psychosocial Helpline. And but when asked about it, the person says, no, I didn't even feel like dialing. I don't think I need help. And can this be a case of stigmatizing psychosocial help? So all these questions are meant for you to think and understand how stigma and psychosocial care are so strongly linked, and how we as civil society partners can help understand some of these emerging concerns. Think within our organizations, as 75% people already said they are contributing to the overall stigma response, and how we can help people even understand that they need help, and how we can sort of support everyone. So really we are talking about social cohesion at this point. We are talking about sharing. We are talking about providing empathy and care, more kindness, more compassion. And as civil society, how we can narrate more positive stories, help people tide through this very conflicting, unprecedented, challenging time of COVID-19 in the country, help people guide towards the resources that are available to handle stress better, but also help prevent stigma and discrimination in the overall process. So with that, I'd like to close the presentation and thank you, Team Dasra, UNICEF, Ministry of Health, my colleague, Dr. Vivek, for joining me in this presentation and providing an avenue to WHO to share with you some thoughts as we move forward in this collective fight. Over.
Thank you, Dr. Chauhan. Thank you so much, Dr. Chauhan. I know it's a big presentation to get through, and sorry for bothering you so much. I just want to move ahead quickly because we have a lot of speakers left for the rest of the 20 minutes. And so I'm sorry to the other speakers also. We'll have to manage through the time. We only have till 3:30, unfortunately. So if I can please request Elnoor and Rachna, Elnoor Aliyev and Rachna Sharma, communication for development specialists from UNICEF, to please go through their presentation quickly and then leave time for Seva also. Yeah, Elnoor and Rachna. We can't hear you.
Yes.
Yeah.
So good afternoon, dear colleagues, dear esteemed partners. Thanks to DASRA and thanks to Ministry of Health and Family Welfare for motivational opening, the remarks. So my points, where I am seafood essentialist for UNICEF Daily Office and my colleague Rachna, also seafood specialist office, and today we'll be talking more on the communication and community engagement. So that's I would like to open my point that's what I believe in apologetics.
Sorry to interrupt you, Elnoor.
Yes.
We are
Can
unable
you
to
hear
hear
me?
you clearly. If you could just
Can you
hold.
hear me?
Yeah.
Can you hear me?
Yes.
So that our presentation is mainly on risk communication and community engagement. May I, can you please go ahead with the slide? So here, the main issue is
Sorry. I'm very sorry. May I request for bandwidth issues then, maybe if you could pause your video and just speak, maybe that will help, because after you start speaking, it becomes difficult. Yeah, thank you.
Is it okay now?
Yeah, for now it's fine. I will message you if there's an issue.
Okay, please. So that's main point here and main message here for all of us. As much as we are all leaders together, we can fight against COVID-19 and its impact. And the biggest one is the stigma and discrimination. And I believe that I believe in the power of knowledge and experience of every single one attending in this seminar. Next slide, please. Can you hear me?
It's not very clear, Elnoor. Can I request, maybe, is there, Rachna can speak through your part maybe? There's a lot, you're going in and out. Rachna, can I request you actually, if you don't mind?
Good afternoon. Am I better?
You are clearer, but if you can speak more like louder or into the mic.
Sure. Good afternoon, everyone. Colleagues, sorry about the tech glitch. Elnoor, I'm just taking over from here, like we had agreed. We are mindful that in terms of time management, we have 3 speakers, and hence, rather than going through slide by slide, I would like to. It's not clear. Even I'm not clear.
Yes, this is great. Yeah, thank you.
Better? Okay. We would like to give the summary comments to you for this session because we are mindful and respectful towards the speaker from Seva and the leaders from Seva who will be speaking after this. In this session, what Elnoor and I had planned to do was to convey the risk communication and community engagement, which comes to fore when any such crisis situation, COVID-19 pandemic in this case, is faced by a country or the globe. And then we wanted to take you on through the communication campaign, the key tagline of CARE, and also the key messages that we have identified for all of us as CSO team to be speaking about consistently, regularly, and always till we kind of get out of this situation. Next slide, important in a pandemic situation like this, as also very rightly conveyed by Dr. Ritu and Dr. Vivek, is that we have to be first, fast, and frequent. We cannot wait. We cannot wait for. Shelby, can you confirm if I'm audible? Because the chat box continues to say that
You're audible, Rachna, but it would be better if you can speak a little loudly.
Okay, I'm literally shouting.
Hold up that mic. I'm sorry. Just if you can hold up that mic part to you. Yeah, thank you.
Yeah, sure. So what is very important is that we handle the situation as soon as possible before any false information or news goes out and hits people out there. Second, it is important to give the right technical advice and facts and not any other fiction-based stories, so that people, communities in such a situation are able to take informed decision to protect themselves, families, and communities that they live in. So these two are the key principles in our CCE, and for which we use the three communication modes, which is mass communication, which is mostly one-way, includes digital communication, two-way systems wherever we have scope for two-way dialogues happening, because that is most reassuring, because there is a feedback loop and a feedback system which we have available there, and also to depend on credible local leaders and local capacities to speak on the issue. Next, please. Okay. Now, what's important for us to remember here is that COVID has forced us into breaking some of the regular practices, good or bad, forget about that, but get into new practices and new norms. And when we talk about norms, it's important for us to understand that there are two conditions for a norm to become active. One, that I think that you expect me to behave that way, first. And second, that I'm seeing everybody behaving that way. And that's how a norm gets stabilized and established in any community. The new norms and new practices related to respiratory hygiene, hand hygiene, mask wearing, and social distancing that we are all trying our best to practice is something we have to help each other to regularly get used to, because that's the only way we can prevent getting affected and infected. Next, please. Next, please. Next one. Okay. Now, what does the data, the quick surveys which are happening is telling us? What it is telling us pertaining to stigma and discrimination is that there are a lot of people who are worrying that when they get back home from the hospitals or from their quarantine spaces, what kind of behavior will they be faced with? Second, they are worrying also about the behavior of workers, frontline workers in the isolation or quarantine centers that they are in. They're also worried about their families and what they will be faced with once they return back. Now, what is important for us to understand is that from where is this worry and fear coming? Perhaps there have been cases, and we know there are cases reported where serious stigma and discrimination led to actions, behaviors, words which were really not favorable. And hence, it is time for us to come together, next slide please, and start practicing care behavior. We have heard many times care, ख्याल रखना, ध्यान रखना. ये जरूरी है हमारे लिए इस समय समझना, for all of us to understand that all of these reports which have told us that these are not the normal times, these are difficult times, but with positivity, we will be able to get over the unfortunate stigma and discrimination which has slowly creeped into the current pandemic situation. Next slide, please. When we talk about care behavior, what is important for us to remember is, I would like you to move on, please. One more slide where we have care. Okay, just stay here. So what is important for us to remember is that when we talk about care behavior, there are some strong values that is projected in care behaviors. Dr. Vivek reminded us that stigma and discrimination, if it is high, it is also reflective of the culture and value of that particular community and country. I think this is the time for the 1.3 billion Indians to come together and show that we come from a care history and not a history where we discriminate against. Compassion, karuna, assurance, dhadas dena, sambal badhana, respect, आदर दिखाना और encouragement, उत्साह वर्धन करना, बताना, motivate करके रखना कि सब सही है और and let's care for each other so that we will be able to get over this situation with positivity. Moving on, I think I'll leave you in the next 2 minutes with 6 key messages that we have, next slide please, that we have put together based on the hotline and calls that we have been receiving and the coordinators have been receiving. First, most important, please do not focus on myths, only focus on the facts. Share facts, do not share fear. It has to become a behavior in today's digital age before anybody pushes a message or before anybody indulges in a lot of binge 24/7 false news watching. Next one. Glass is half full or half empty is the classic example that we have to keep in mind. The glass in the current situation has to be half full. We cannot see the half empty glass. Focus on the positive. Focus on the champions, the stories of brave hearts who are helping us get over this either through the sanitation workers or the entire health community and fraternity. Third, next one please. Important that this is not about aap ya main. This is about anyone can get infected if you're not careful or if there is a chance encounter with the virus. I think it is important to convey this, that it is not about rich and poor, it is not about urban and rural, it is not about tribal and mainstream, it is not about a foreigner and an Indian, it is not about a girl or a boy, it is about anyone and everybody. It is important to normalize it. Fourth, let's focus on what Dr. Ritu beautifully explained, what we can do to support each other. Very, very important. Let's praise each other on that. Show the usual care, compassion, assurance, respect, empathy, encouragement, and love. Fifth, appreciate the workers, health workers, sanitation workers, the auxiliary workers who despite all odds are making sure that our houses are running well and the patients are being taken care of. Appreciation doesn't cost anything. But appreciation yields results in terms of amazing high level of motivation. And that increases the efficiency in terms of working and delivery. And the final message is, when you are talking to somebody, especially if they are affected or infected, please respond with empathy. Be a good listener, share facts, and motivate them with the right messages. These 6 mantras, if we wrap around ourselves with a care behavior binding, I think we are good to go and good to make the change that is required over the next very trying 3-4 months that the country is going to face. Over, and thank you so much.
Thank you so much, Rachna. Thank you, Elnur. And I appreciate you ensuring that we end on time to give Seva also the time. And, definitely resonate the care approach. And thank you so much for those 6 key messages. Very important. Yes, to all the people on the chat asking, we will share this back as a package. Also, I'm sorry, we are running out of time. We are going to try and extend by 5 to 6 minutes a little bit. We'll have to, if you could just bear with us. And also we have had a few questions and we don't have the time to respond to it right now, but we'll try and see if in the follow-up email we can get answers, or in the next discussion that we have we can, share back some of the answers to this. But there was a question for Dr. Ritu and Vivek on guidance on tools that we can use to determine level of stigma in the community. And also there are some validated tools to measure coping mechanisms in the community. That was one, set of two questions on measurement. And secondly, there was also another question that was generally for the speakers on any specific suggestions to support children and caregivers looking after persons with disabilities. We've noted this, and unfortunately, we don't have the time to get back with answers. So therefore, I move on to Seva. Thank you very much, Seva, for having patience. Rehana Ben Riyawala, Vice President Seva, as well as some of her colleagues, Miss Sophia Naz, Miss Jagrut, and Miss Pali Ben are with us. So I hand over to Rehana Ben to share with us some of the insights and learning from the work that Seva has already started doing in their communities on destigmatization and prevention of discrimination. So if I could please ask Rehana Ben, and please do keep to the time. Thank you so much for bearing with us.
Namaste and good afternoon. I'd like to thank UNICEF, Ministry of Health, and Dashra, first of all, to give us this opportunity. I'll be, like as mentioned, I'll be as short as possible so that we do not run out of time. अगर मैं सिर्फ सेवा के बारे में शुरू कर रहा हूँ तो like as we are all aware that Seva is a member-based organization. Can we move on to the next slide? Yeah, Seva is a member-based organization of poor self-employed women workers from informal economy, and we have been working. We have been started since 1972, and today we have a membership of 1.9 million poor women workers across 18 states of India. And we also have an experiences in working on the neighboring SAARC countries. Our membership base is comes from more than 100 different trades, and Gandhian thinking and philosophy has been a guiding force for Seva. So we believe a lot in Gandhian values and Gandhian philosophies. Can we move on to next? We work with a very holistic approach, and our strategy is joint action of union and cooperative. By union, we provide the members with the voice, identity, and visibility of the members in various trades, and bring them in work towards bringing in their voices in their society, in the community, at the national and the international level as well. And at the same time, we do a lot of development related work wherein we form member-based organizations and collectives, which may be in the form of groups, association, cooperative. Lately, we have also gone for-profit and not-for-profit companies. So these are the social enterprises which are being owned, managed, and operated by the members themselves. So we at Seva, if you want to say, we are like a banyan tree wherein the leaves are our members, the trunk is the main Seva which we are talking about, and then each of these member-based organization are like the branches which then takes their own root, and they have their separate bodies and all. So next please. So when we talk about stigma and discrimination, we have been hearing since few years on the stigma and discrimination during this pandemic of COVID-19. But at the same time, if we see in our society, there are a lot of social and economic discrimination amongst in the society and in the community. So Seva has been, through its Gandhian values and philosophy, Seva has been working a lot for its members, otherwise also to deal with the discrimination and the stigma which we are talking about. Like there are, if we see that there are not based on gender, caste, classes, and religion, and also the economic discrimination is also there. So SEVA provides these women workers their voices and identity, and at the same time, the philosophy which we are working on and the Gandhian philosophy, the leadership at the grassroots level works toward that we do not discriminate through the gender, class, and caste and religion, but at the same time we see that from which trade the members are coming and how do we work on, say, strengthening the economic and societal or say decision making power of these women members. And this is how we have been working since years. But then at the same time, during this situation in COVID-19, can we move on to next slide? So like we have been working in the grassroots area, and then we have a lot of our leaders and master trainers and members working closely with say the members of SEVA. During the situation of COVID-19, like the stigma and discrimination has been faced by SEVA members in various say trades. To name the few, like the domestic workers were also the one who have faced this kind of discrimination. The street vendors were also the one, the migrant laborers who are coming from the cities and the villages or in the rural areas are also say the one. Even the social enterprises which SEVA has been working upon, in that also like we have seen that how do we educate them and create an awareness and education among these members and among the community itself, so that this stigma and discrimination doesn't be that. So like due to this, what we see is that there is a fear and panic among the community members, and then there's also a loss of income and employment among the say the members who are majorly like day-to-day wage earners and like street vendors and domestic workers. And like if you go into the urban areas or say the poor community members, you'll also see that they have to live, the houses wherein they live are very short, small spaces, and then they have to go through say the social distancing which we are talking about. At times it's very difficult. So there's also a kind of distress feeling or say because of say the spaces they own or say their livelihoods are suffering and all. Can you move on to next slide, please?
Yeah, Rehana Ben, sorry, should we also then ask, Sophia, Jagrut and Pali Ben to speak? We are at 3:30 right now.
Yeah, I just have 2-3 slides to go on and then we'll ask Pali Ben to...
Okay, if I can request you to wrap up in a minute so that they also get a chance.
Yeah, definitely. So like the responses, what we have been talking, responses from our leaders has been in say the various areas, and it has been say multi-pronged approach which we have been taking on. So first and foremost, like we had also working on providing the trade-wise education to the members, say what all care they need to be taking while they are in this various trades like domestic workers, waste pickers, vegetable vendors, and food production and all. So we have different trainings, customized training done for all these say members in the various trades. So we also have started with the telemedicine services which would cater to the mental health issues of which are arising due to the COVID-19 situation. And so we have the psychologists which are providing the counseling to our members who are facing with such issues. Then a lot of awareness and education with reference to COVID-19 has been say distributed amongst our members across say 18 states in India. And all this, and what are the kind of awareness education which needs to be taken, what are the kind of precautions that needs to be taken, how do we cope up with the fears, and say what are the myths and misconceptions among this disease and all. So these are the kind of information and awareness education we have been providing through audio, video messages, posters and all. We are also as one of the speaker also mentioned about, say, it's very important that we work with the children as well. So we are working with the children as well. So how do they relieve their stress, and then they do engage themselves into the meaningful and mental activities, which would further say help them to keep away from the stress and fear which has been bringing because of the situation. And then at the same time, we are also like working on how do we restructure our social enterprises so that the livelihood of our members are not affected. And so what are the control measures or say the precautions which needs to be taken during the activities which are being done in this social enterprises. And then we are also partnered with various say government agencies like AMC, wherein the e-rickshaws and the vegetable vendors have been linked so that the livelihood of the members are also not affected. And at the same time, we are also working on how do we provide with the home delivery services of the vegetables to the community members after taking all the precautions and all.
Okay.
Can we go to the next?
Ma'am, can I have the other speakers speak? We are run out of time. We are at 3:32, ma'am.
Yeah. Okay, so these are these are various communication channels which we have been working upon, and majority of them, as I mentioned, like we work on a virtual work platform wherein the trainings has been provided, social media platforms wherein the posters and audio messages and videos has been given to the leaders, and then they are further forwarding to our community members as well. And another thing is like say the door-to-door community events, because we have the reach in the grassroots, the ward leaders or say the district coordinators and the master trainers are also bringing in say strong community linkages, and they are also disseminating the messages. Can we move on to the next slide?
Yeah, should we ask Yana, Jagrut and Parliament to speak? Otherwise we have over people are starting to log off, ma'am.
Yeah, this is the last slide. The challenges and the key lessons learned that during the social we need to work communication. We need to understand what the community is facing through, and accordingly we have to have our responses as well. We need to have strong partnership and local with the local leadership at the village and the block level, and with the state, and then actions has to be coordinated with state and central government as well. And like we also need to leverage upon say our micro and small enterprises and link them with the market as well. So these were the major areas wherein Seva has been working upon, and these are the lessons learned which we need to share with everybody.
Yeah, Hannah Ben, we have reached 3:30, and so can I request just one person, because we have to wrap up, share information on the chat, and there are many people who are dropping off. We've already lost about 30 people. So people are dropping off because it's going off time.
पालीबेन, आप बताइए अपना अनुभव।
हाँ, नमस्ते बदाने।
पालीबेन, अगर आप हिंदी में बोलो तो।
नमस्ते बदाने।
नमस्ते।
मेरा नाम पालीबेन है। मैं सेवा साथे 25 वर्ष से जुड़ी हुई है। अभी मैं गीतांजलि में प्रोडक्शन का काम संभालती हूँ।
And she is say looking after the production of Gitanjali, which is a voice speaker cooperative, and we are into the paper making products.
अभी मैं गीतांजलि में कंटेनेंस जोन में है। मेरा गीतांजलि और सरसपुर और गोमतीपुर में बीच में ये कागज चुनने वाली बहनों ही आती है यहाँ पे, तो बहुत दिक्कत आएगी। हेलो,
हाँ पार्लिमेंट बोलता जाओ तुम्हें।
हाँ तो गुजराती ज बोली दो।
हिंदी में बोली શકો तो बोलो फटाफट।
हाँ तो वो बहनों अभी हमने काम शुरू किया है पहली
बोलते रहो।
तो अभी हमने काम शुरू किया है तो सब बहनों को बोलते हैं कि अब तुम घर से निकलते हैं तो उकाड़ा पी के और गीतांजलि आ जाने का, और बार बार जे मास्क पहन के आते हैं मास्क तुम बाहर रखने का, और दूसरा गीतांजलि में आएगा तो वो मास्क दूसरा पहनने का है, दूसरा पहनने का है, सबसे दूरी रखने का है, दूर बैठने का है। अभी हमने ये भी दिया शाम सुबह में और शाम के घर पे जाके भी इसको उकाड़ा पीने का है, सबके नहाने का है। और मास्क पहनने के बहनों मास्क पहनती है तो अभी क्या बोलती है कि मास्क में हमने पसीना होता है, तो हमने बोला कि आधे घंटे के बाद ये मास्क निकल देना, दूसरा मास्क पहन लेगा और सांझे गर्म पानी में धो लेना। इससे हमें बताए। दूसरा सैनिटाइजर से आप आओ तो सैनिटाइजर से हाथ साफ करने का, आधे घंटे जो सैनिटाइजर से नहीं धोने तो पानी से धोने का, कल्ला के पानी से हाथ धो लेना ओ साबु से। फिर हमने हमारा माल जी आते हैं सेंटर ऊपर, कागज का है, टाइटल है, तो ये हमारे 48 कल्ले की बात कटिंग, 48 कल्ले की बात कटिंग करने का है। ये हमने अभी चालू करा है।
जैसे कि पानी बहन ने बताया, हमारा जो वेस्ट पिकर्स का कोऑपरेटिव है उसमें हम कैसे ये सारा ध्यान रखते हैं और कैसे मेंबर्स को अवेयरनेस एजुकेशन देते हैं। एंड एक ये भी था उनका कहना कि जैसे हमारा जो प्रोडक्शन प्रोसेसेस है उसमें अगर कुछ ध्यान रखने वाली चीजें हैं तो वो भी हम कैसे करते हैं, ताकि जब हम काम करने के लिए आए तो एक दूसरे के साथ मिलकर तो काम करें, पर एट द सेम टाइम हम प्रिकॉशंस कैसे रखें उसका, ताकि हम एक दूसरे को से भेदभाव नहीं रखें। पर हाँ, ये प्रिकॉशन रखना जरूरी है जब हम आए तब भी और जब हम वापस घर जाए या घर से निकले तब भी। तो इस तरीके से हम ये सारा फाइट कर सकते हैं, और उसके साथ साथ हम वी कैन आल्सो स्टार्ट विद आवर लाइवलीहुड एक्टिविटीज एज वेल।
Yeah, thank you. Thank you, Pali Ben. Thank you, Rehana Ben. Thank you very much for sharing your experience. Sorry that a lot of people dropped off, but we hope to share the recording with everybody. So thank you all participants. Sorry for, sorry for going so much over time. I apologize. We had all the speakers who wanted to share a lot of good, useful information. Thank you to everybody. Thank you, USA. Thank you, WHO. Thank you, UNICEF. Thank you, SEVA. Thank you all the participants and partners from civil society, funders, government NGOs. We will do a similar in-depth training like we mentioned. And as you can see in the chat, there is a survey for young people that DASRA is conducting to get collective information on some of the interventions and understand what are the vulnerabilities that are faced by young people. So I please request you all to copy paste that link and then try and see if you can please respond to that survey. It will be very, very helpful. Thank you. We will be in touch. We will share all the material, and please feel free to email us if there are any questions. Thank you, everyone. And thank you, Dasra, my team also, for organizing this. I appreciate it. And thank you to all the development partners working on, the prevention of stigma and discrimination. All right.
Thank you.
We will end now. Bye-bye.